Imagine this. What if we could look into the future of our aging brains? What if we could predict with remarkable accuracy whether our brains would stay sharp or begin to falter? Would we change the way we live our lives today? Would doctors approach different brain aging? Would families be better prepared to face the future of brain health with clarity instead of uncertainty? These are not just theoretical questions. These are real possibilities, thanks to the advances in biology, neuroscience, and computational science. And the answers to these questions could transform not only how we view brain aging, but how we prepare for it. I'm a physician scientist at the Montreal Neurological Institute and, as Alan mentioned, a clinical lead at Perceive AI. And today I will share a vision for how prognostic insight can help shape brain aging. As we age, it is vital to understand that our brains don't all age the same way. Some of us will retain quick thinking, sharp memories, and vibrant cognitive function well into our 80s and beyond. But for others, aging will bring cognitive challenges, slower thinking, difficulty processing information, and in some cases, cognitive decline. This difference in brain aging is not random. It is shaped by a mix of genetics and lifestyle choices. Also health disparities and even environmental related factors like pollution, but also cumulative burdens like heart disease, diabetes, hypertension, and many other factors. Very recently, analysis of large cohorts of data using computational brain models, have mapped the diversity of brain aging across different regions. For example, only last week, a large cohort across Latin American countries found significant brain age gaps among women in the region compared to women elsewhere, highlighting the link between accelerated brain aging and health disparities. Other recent studies, also within the past month, have mapped brain aging across large data cohorts like the one that Alan mentioned, for example, before, like the UK Biobank. And some of them have found 5 dominant phenotypes of brain aging related to brain atrophy as we age. These are, of course, shaped by lifestyle factors and genetics, but these patterns help predict disease progression and mortality, offering new ways to understand how specific brain changes impact aging. These insights, enabled by MRI and AI technologies, provide a more detailed look at the biological and pathological factors influencing brain health, paving the way for a more personalized section of care and early interventions. And even now that we know much more about how brains age, predicting how an individual brain, any of your brains, will age, it still remains a mystery and has remained a mystery for far too long. But why is it so hard? Because our brains are incredibly resilient. They adapt, they compensate for injury, and change in ways that even experts understand fully. The good news is that today, we're on the cusp of breakthroughs that could finally give us the tools to make those predictions. Now, here's where things get really exciting. Imagine being able to predict how your brain will change in the future. Thanks to the advances of artificial intelligence and computational tools, we're getting closer to making that a reality. But let's make it step by step. Let's go a bit behind. And to truly grasp what comes next, we first need to understand how different markers behave at various stages of aging and disease. We've already known that the presence of certain biomarkers at high levels are a red flag in terms of underlying brain health conditions. Researchers, even here at McGill, like Sylvia Villeneuve, Dr. Pedro Rosaneto, Just Poiré, and others had mapped how, for example, blood biomarkers shift before the first clinical signs of Alzheimer's disease even appear. Other researchers this year at Cambridge University have developed models that combine brain scans with biological markers, revealing early warning signs of cognitive decline and Alzheimer's disease, often before symptoms even emerge. Meanwhile, scientists here at Toronto and Sunnybrook have created a tool that dynamically tracks the progression of damage to the brain's white matter. And they compare it in Alzheimer's disease and normal aging to see how they evolve differently. These are just a few examples of the amazing work that has been done only this year, and how far we're coming to understand brain aging and what could be considered normal aging at a given age. Now that we've looked a little bit at the biology of brain aging, how do we train a model to predict where my brain or your brain will be in 2 years? If we're here, how do we know which of this path are we going to take? Are we going to be measuring, for example, structural changes in the brain? Are we going to be examining neural pathways? Are we focusing on cognition or function? Or are we just zeroing in on the future of your individual risk? If we focus on an actionable outcome, let's consider the risk of future diseases like dementia. Can we predict whether someone will experience cognitive decline and whether that cognitive decline is going to lead to the individual developing dementia? At Perceive AI, we believe we can by using precision neurology. By building a prognostic engine with models trained on data from thousands and thousands of individuals, both those with brain diseases and those healthy individuals, we can forecast how an individual cognitive decline or cognitive status will evolve over a given period of time, and we can track that trajectory. Some of the more complex models include factors like genetics or neuroimaging, but there are also simpler real-world models that can make similar predictions with just a few basic data points such as your age, your sex, or results from a simple cognitive test. And here's where the real benefit comes in. It's not just about knowing what might happen. It's about creating a window of opportunity to act before it's too late. Let's take a moment to imagine how this might look in practice. A person, let's call her Chantal, walks into her physician's office for her regular annual checkup. She's in her mid-60s, she's healthy, with no major concerns, it's just a checkup. But she's concerned because her mother lives with Alzheimer's disease. But today, instead of doing just this regular checkup that would include, for example, things like taking your blood pressure, analyzing some risk factors, the doctor, her physician, offers something new, the opportunity to see into her future brain's health. Using a combination, let's say, of an MRI scan and a simple cognitive test, Chantal's data is fed into an AI model. And in less than a minute, that model predicts a high risk of progression to dementia in the next 4 years. That AI model also provides detailed information on which features are driving that high-risk decision. It's nothing that she would have noticed yet, Chantal, nothing that her family physician could even see in a standard test, but it's enough to suggest that Chantal might be at high risk of cognitive decline. Now, think about what this knowledge could entail for Chantal. With this early warning and her past risk of history due to her mother, her doctor can actually recommend certain things like lifestyle changes. The physician can suggest closely monitoring her, even if there's treatment, providing preventive treatment. In short, Chantal has been giving a gift. Time to prepare, time to act, time to prepare, time to make future decisions about her own health. The potential of this technology goes beyond individual cases like Chantal's. Imagine the impact on our healthcare systems if doctors could actually predict who is at risk of diseases like Alzheimer's disease or dementia decades before those symptoms even appear. We could save by preventing the need of late-stage interventions or long-term care. And imagine the peace of mind we could give and offer families by giving them answers before the uncertainty and anxiety sets in. Think about it. If we could predict cognitive decline or early signs of Alzheimer's, we could intervene much, much sooner. We could craft personalized plans, tailor lifestyle interventions. We can actually provide treatment within that right window of opportunity. And even provide, for example, cognitive exercises or lifestyle modification, all based on forecast risk. Just imagine the peace of mind that could bring, knowing that there's a roadmap for managing brain health. Now, of course, this vision doesn't come without any challenges. These predictive models are still in development, and they've shown great promise in research settings. But applying them to the real world, with all of this complexity and variability, is entirely another matter. This is because our brains are incredibly diverse. Each of your brains is unique. And the way that our brains age can be completely different from somebody else. Your brain and her brain might follow completely different paths. And even, let's say, in identical twins, like there's a different path on how each of those brains are going to evolve. Factors like education, socioeconomic status, and even cultural difference can influence brain health. And let's not forget that our understanding of how brain changes over time is still evolving. But this shouldn't discourage us, because progress is being made every single day. Now, I want you to think a bit more on a personal level. Think about yourself, your family, your parents, your grandparents. What if you had access to this kind of predictive technology, predictive power? The real value of this prediction isn't just in the data or the technology, it's in what they can do for you and your loved ones. Accurate predictions can help guide healthcare decisions that could slow down cognitive decline, prevent disease progression, or even eliminate the anxiety and guesswork about what might happen next. Just as in oncology, where patients already receive a prognostic insight alongside their diagnosis, this approach is beginning to emerge in neurology. And it's not just about treating disease, it's about preserving quality of life. As we move forward, while we might not have necessarily a crystal ball, we have the next best thing, prognostic technology. So let's harness the power of prediction to guide us into our future where brain health is something that we can actively shape. Imagine a world where doctors could detect problems earlier, patients can change harmful behaviors in time, and families can be prepared for what lies ahead with more certainty. We have the technology, we have the tools, and most importantly, we have the opportunity to change the way that we approach brain health in the future. Because in the world of brain diseases, time is brain. Every moment counts, and together, by embracing the tools that can forecast our brain health, we can turn these moments into opportunities for a healthier future for all. Thank you.